This is the middle stage. The middle stage is probably the longest stage, and this is where we see so many different changes. So the objectives, everyone can still see and hear me?
Yes,
Anybody? Okay.
You're still good, Debbie.
Okay, great. So what we're going to accomplish as we go through this middle stage is to recognize and know the symptoms and the care that is needed in this middle stage. And this middle stage can be a long stage. So there's changes that take place, but not in any, not in any line where, okay, 1 month is this or 2 months. It really is very different in people. We're going to describe the relationship changes between the loved one and the caregiver. We're going to explain how caregivers can maximize safety, prepare for emergencies, and access respite care. And we're going to list effective ways to provide personal care and manage challenging behaviors. And sometimes that's very difficult if you're doing it for a loved one. So here we go. Let's take a look first at what the middle stage problems might be. It would be memory problems, thinking problems, and behavior problems. It is not a normal part of aging. And I want to stress that it is not a normal part of aging. People who really don't know much about dementia and Alzheimer's, she forgets a lot. It's just she's getting older. No, it is not a part of normal aging. Now, the symptoms can vary among individuals. And, people don't go through it at the same rate. They don't have the same symptoms at the same time. So, it's important to really know what these different symptoms are and then how we can deal with it. And this disease, a disease of the brain, the disease leads to nerve cell death and tissue loss throughout the brain. And ultimately, it affects nearly all its functions. The disease then progresses to other areas of the brain, and the brain changes affect the symptoms. The front of your head could be, all of your memory centers, while the back of your head has to do with visual changes. So it depends on how the disease progresses. And depending on what these new symptoms are, it will affect the care needed. Now, take a look at these pictures of the brain. The one on the top left, you see that little blue area, all right? That's right now where their Alzheimer's in. That's the middle stage, beginning stage rather. In the middle picture, you see that dark first area, and then you see the blue spread a little bit to the left, a little bit to the right, all right? So the disease is progressing. It's starting to affect more parts of the brain. And in that bottom right picture, we see more blue. We see the initial area, and we see it's more blue going to the left and going to the right and meeting that other section. So as a person progresses through the Alzheimer's stages, may start out with a small area, which is your top left, and end up on the right with much of the brain being affected. And the Alzheimer's disease is one that affects the nerve cells, and ultimately the brain shrinks because the nerve cells are dying, and from the beginning to the end, there is a noticeable difference in the size of the brain. So some of the symptoms we see as a result of that is memory decline, changes in behavior, which I think is one of the hardest change that loved ones have trouble with. Increased trouble performing daily tasks. Daily tasks, call them activities of daily living, brushing your teeth, combing your hair, sitting down to eat. More prominent language problems where a person can't find the right word, can't express what in their mind and they want to say, but they can't find the language and the words for that. And ultimately, they need a greater level of care. I need more help with bathing and, bathroom functions. And, it increases that need as the disease progresses. Well, what we have to do, not easy, is to maintain the person's sense of self as you assist. And of course, unlike a child or baby, that is dependent, doesn't know anything different, a elderly person, a person with one of the stages, a middle stage of Alzheimer's, there's a part of them that knows that, "Oh, I need care. I don't want care. I don't want you doing this." And so it's really important that we maintain a person's sense of self, and we ask them to assist us, or we do it with them. One of the approaches later on, I call it hand over hand, where, all right, they have to brush their teeth, put the toothpaste, let them hold the brush, but you hold their hand. And this way, the teeth brushing is in the right direction, in the right place. Activities, right? Another important area in maintaining self. It's, you try to do the same things that they did before this diagnosis. It's important for their brain function. It's important for their self-worth. And it's really important that you have a daily routine. And I know it's not easy, but in the morning you take a walk, then you have lunch, then you do this. Having a schedule is really, really important. They may not know what time it is or what day it is, but oh, we're doing, a walk or exercise or something, activity, and then they know it's lunch. It's a steady routine. Right before the pandemic, I was working in a daycare for people with Alzheimer's, and they knew they were doing their exercise. We had a routine, and they knew right after that they'd have lunch. And so therefore, well, come on, we have to do exercise, because we have to go to lunch. And it worked. But the routine is very important. When the pandemic hit and all of these people in daycares were now home, a loved one cannot keep up that same schedule after, day after day after day. And what the loved ones would often say, when we spoke with them, you can see the decline right in front of our eyes. They just want to sleep or sit in the chair or, whatever, that constant activity, that schedule, really, really is important. Communication. Communication gets more difficult as time goes on. In their mind, they know there's something they want to say, but they can't find the words to say it. And you will see so much frustration on their part. And you look around going, nah, let's see what activity or what was somebody saying, or you try to figure out, and so you can help them. Sometimes you can, sometimes you can't. they get very frustrated, or they, not important kind of look to you. So the communication is one of those areas that definitely become very difficult. Eating, eating and bathing. Now let's talk about eating. Um, Again, as time goes on, they have certain foods they like, but as time goes on, they're not as hungry. Um, as more time goes on, they really have difficulty using the utensils, or they'll look at the utensil and not know what it's for. I had a cousin who actually had Down syndrome as well as then Alzheimer's. He would look at that fork, twirl it around, go to clean out his ears, but everything but for what it was supposed to be used for. At this point, it's a good idea to have finger foods, because then it doesn't matter. They cut it so it's in pickup proportions, and let them eat that way. Bathing. All right, well, they don't want to bathe usually, for the most part. Um, and you have to, number one, are they that dirty? Where they don't have to have a shower every day unless there is a reason, like they soil themselves every day, that kind of thing. Bathing becomes frightening for them, especially if it's a shower. Um, Out of the sky, as they perceive it, is this water coming down. Think about it. I can't remember a shower, and then all of a sudden there's this water, and it may be too hot, too cold. It frightens them. So bathing is a difficult thing. Another point with bathing is modesty. Yeah, now I have to get completely undressed in front of whoever, and have somebody help me with the soap and getting clean. So bathing is another difficult task, that you try certain things, see what works. Sometimes having a stranger help with bathing as opposed to a loved one might work. um, uh, a lot of people that are currently with dementia and Alzheimer's, think of the age that they grew up in. People who are, in their 80s, 90s, grew up where they probably didn't have a shower. They had a bathtub, and you didn't bathe every day, you bathed Sunday. So, know a little bit about the background of them and their family. So all of these things have to be taken into effect to help them with their daily care. So let's talk more about communication. They definitely have difficulty expressing their thoughts and their emotions. They have trouble understanding others. They like sports, been so much sports on. They always used to watch sports. People get together, they talk sports. Now they don't understand what people are saying. And when that happens, people tend to uh, shy away, go someplace where they're not part of all of this discussion, because they don't understand. One of the things I do want to mention is hearing aids. If people have trouble, understanding, do they have a hearing aid? Do they need a hearing aid? Do they wear their hearing aid? Um, that has certainly been shown to help. Being able to understand what others are saying. It's not the end all, but it's certainly a factor for those that need or wear hearing aids. Some very specific challenges that happen. Word finding. Oh my gosh, it is so difficult to watch.
Well, some of the misconceptions I think about Alzheimer's disease in the middle stages are that a person is no longer capable of being part of a decision or making choices. And yes, their cognitive abilities are changing, and yes, they may be increasingly confused, but they can still participate in discussions and in decisions. And it's really up to us to adapt, whether it's the environment or the way that we're explaining something to them, to help them participate in those decisions. So I think that is one common misconception, and it's an understandable one. The brain is such a difficult thing to understand, and this disease is such a difficult disease to understand. And so when we see someone experiencing these losses, we can easily make assumptions. Well, if they can't remember what they did this morning, they obviously can't be responsible for choosing where they would like to be living in a few years. And that's not necessarily the case. They can still participate. We just have to modify how we present things and modify the environment so that they can participate.
And Mary's had a very good point. It's we that have to adapt. They can't change. This is the way they are now. It's us that has to make the changes. And we have a saying is like, we have to get inside where they are, look at life through their eyes. They are not going to adjust to us. We have to adjust to them. So some of the best ways to communicate: identify yourself. Just because you were there yesterday or this morning and now it's afternoon, always identify yourself. Hi, I'm Debbie. And, that's good. They know who you are. Don't assume that they can see a name badge. And a lot of times they are hard to see. Use clear, concise language. Don't say, run-on sentences and long phrases. So it has to be clear and it has to be concise. Break down instructions. Don't give them a whole morning set of instructions. It's too much for them. They won't remember, and it could be confusing. Okay, we're going to now get dressed and we're going to have breakfast. That's it. Now, when you're at breakfast, okay, we are going to go into the craft room. Right? And you have to really break it down. Don't give them more than that at a time. Leave extra time. It takes a while for a person to comprehend what you're saying. You've got to give them extra time. You can't be rushed when you're dealing with and caring for a person with Alzheimer's. You have to make sure you have left enough time, and they do need it. Don't ask too many questions. Turn questions into statements. It's okay. Now we are going in the craft room. Don't ask, do you want to paint or do you want to build something? Just go into the craft room and then, ask them, oh, do you want to paint today? That kind of thing. Not too many questions. When you ask a question, especially a yes or no question, chances are they're going to say no. So you want to try and avoid as many questions as possible. Always try to turn a negative into a positive. And, easy to do that. We need a positive vibe. They need to feel that. Avoid talking as if the person is not there. And that's a tendency people have. There's 3-4 people. Let's say you're in the doctor's office. It's you, a person with Alzheimer's, and the doctor. and you want to, say something, and you completely pretend that your loved one is there, and you talk what we call over the head. So just to the doctor, it's uncomfortable for them. They feel like they're nothing. And we can apply this to a lot of situations, like people in wheelchairs. Don't talk over their head, talk with them. Be aware of your tone of voice. Even if they can't always comprehend the words you're saying, the tone of your voice they can. Is it an angry voice? It is, I've had enough voice. Is it a nice, calm voice, loving voice? Really be aware of your tone. Take the word thank you. You can go, thank you, or thank you, or thank you. Just same words, but the tone says something different. Family relationships change, right? And that's normal. That's okay. We have to just figure out what the new relationship and how to deal with it. Partnerships begin to feel unequal. And of course, that's another change that you have to make. Is, all right, I can't expect this kind of help anymore. I'm going to have to, pick up that role and be okay with it. Talk to people. If you're having a problem, try and get help. Caretakers take on more roles and responsibilities in their support of the person with dementia. And that is what happens. If the one with dementia and Alzheimer's paid the bills, of course they can't now. That's a role you have to take over. Ordering different things, you will have to take that over. So, as time evolves and changes happen, the roles change as well. With that comes higher stress. And dealing with stress, as we all know, is very difficult, and even more so with a serious disease like Alzheimer's. Recognize the stress. Talk to people, see your doctor. You need to take care of yourself as well as your loved ones. Social relationships. Well, the stigma can influence perceptions and relationships. I think the word Alzheimer's today is like what the C word was many years ago, the C for cancer. Like people whispered it. Do you know she has or he has cancer? Right? Now it's Alzheimer's. I know for myself, being so involved with Alzheimer's, that there are people and groups. As soon as you say you're from Alzheimer's, you can see the backs go up. They don't want to know yet about Alzheimer's. So it's interesting. At least I find it interesting to watch people's reactions to the Alzheimer's word. Try to educate people close to you about the disease. You don't have to do a full program unless they want, but little by little, talk about Alzheimer's, talk about, what happens in that first stage and now middle stage. So, try to educate people as best as you can. It seems, and again, my opinion, that people aren't so interested unless it affects somebody that they know and love. And of course, on the other side, I don't want to know anything about Alzheimer's. Just afraid of that word. Take the initiative. If your loved one has Alzheimer's and they seem to be backing off a little bit, they're scared. They don't know enough about it. They're afraid to talk to you. So you take the initiative to contact family and friends and talk to them and, see if they will express their questions or concerns and let them know it's okay. We'd love to see you, talk to you, whatever. Cute little couple on our picture here, right? All right, let's talk about intimacy. The disease does change the nature of your relationship. Changes caused by the disease may result in changes in sexual feelings in caregivers. There also may be changes in sexual behavior in the person with Alzheimer's. And again, everyone is different. I have seen people with Alzheimer's suddenly become sexually aggressive. And the loved one will go, well, that person never acted like that before. Well, it is a result of your brain changing, and it's something that one needs to watch and be careful, and make sure safety is for everybody. And finally, simple physical expressions of closeness and love are important to everyone. That holding of hands or just being close, a little kiss on the head, just something to show that there is love, and there still is love, and everyone needs to know that there is love. So it is a part we don't think of, intimacy, but there are changes, but there are things that you can do. Let's talk about some meaningful activities. Structure and routine are important in this stage. Structure, like I said, you might have to modify activities to meet a person's changing abilities. But some of the things that maybe you can do together, gardening, right? In that spring, plant flowers or vegetables that you have to always check, herbs, something that you can do together. One of the things I saw, I thought was a great idea, was having a higher table with the dirt in it, because it gets harder, and your balance may not be that good, where leaning down or bending down or sitting down then becomes harder. But gardening is very relaxing. It's very therapeutic. So, engaging in that in those months that we can, that's great. Play games together, whether it be a board game, a card game, or anything else that you can do together. And another thing you can do together is cook. Yes, you can, little by little, if you did cook together before, fantastic. But if not, start little. Oh, could you whip up the eggs, and or something you're cooking, and now can you set the table? I had one gentleman who liked to load the dishwasher. I was a happy person because I hate the dishwasher. And, it started because he told me I was doing it all wrong. I'm like, all right, you do it. And so that was his thing. He liked to help me load the dishwasher. So anything you can do together is great, and as their abilities change, that has to change as well. It may just be folding towels or washcloths at some point, but you're doing it together, and there's that feeling still of, being together and closeness. All right, let's hear what Melanie Chavin has to say. She is Vice President and Program Services at the Alzheimer's Association in the Greater Illinois chapter. Okay, Melanie.
What's really important is to remember that if you've got an artistic background, if you're an artist or a musician, or if you've been an actor, that those are things that are so deeply ingrained in you. And as you develop dementia, you may not be able to engage in them the same way you used to. You may not be able to pick up your instrument and play an entire sonata or something. But to be able to have the opportunity to enjoy music, if you're a musician, is still really important. So family members need to remember that maybe the person can't play the way that they used to, but maybe they'd really enjoy going to a concert. Or maybe they'd enjoy learning how to play a different instrument. When I was a music therapist, I used to work with people who had been professional musicians and couldn't play their instruments the same way that they used to. And one of the things that I did with them that was lots of fun for me and for the person was either adapting the way that they played the instrument, simplifying arrangements, if they played piano, say, or finding other instruments that they might be able to play that would be a little easier to learn, because you've still got that musical ability. What's so important, though, to remember is if you have a family member that's been artistic in any way, giving them the opportunity to engage somehow in artistic pursuits is just so important.
Melanie is so right. Music transcends so many things. What we used to do along the same lines as Melanie is I would find little instruments like the tambourines and things that you hit, and a lot of it was for children in a music program, and we would use that and follow along with songs. And speaking of songs and music, people love music. I have seen people who do not speak, but when songs come on that they know those words. Whatever decade we're talking, music from the 30s, 40s, 50s, depending upon the age group. Patriotic music, everyone knows that, and everyone sings along with that. So I think music is fantastic to add to a day, and it's fun to listen to. This is the season with all kinds of songs, and listen to them and listen to what was popular in their age that they listened primarily. So it's a great thing, music. Okay, some other care needs. Right, more assistance is needed to manage hygiene and personal care, and I think we did talk about that before. You could start out with notes. Eventually, you have to be more active in their care. Go to the hand over hand approach, and at some point, you may have to do it for them, but explain what you're doing. Don't just shove a toothbrush into a mouth. Explain, we're going to brush your teeth and this way they know what's happening. This is a stage, or this is a behavior that is going to require increased supervision. You're always concerned about safety, and you do want to reduce the risk of wandering, something that often happens in that middle stage. And wandering is, kind of walking out the front door and taking a walk. And usually they're looking for something, and it's usually home, because in their minds, they tend to think of the home they grew up in, not the home that, they've lived in for the last, 40 years, but their childhood home. And you want to certainly reduce that risk of wandering. And as I have said previously in other presentations, there's all kinds of safety devices on doors and windows. One of the things a family told me that they do is they have a dark rug, right outside the door. That tends to be, you wipe your feet. That dark black rug or whatever it's made of To people with Alzheimer's, it looks like a hole, and they're afraid to step down onto it because they don't want to fall in a hole. And you know what? I have seen that. It doesn't help with everybody, but it does help with some people. They go to put their foot down and they see this dark hole, quote unquote, and they stop. And, it's enough time to get someone there to help them, alarms on doors. If it opens, you hear that. So, it's a time for making changes. Just one more change for safety. Meal times. Eventually, people lose their appetite and they lose interest in food, and that's common. And, you almost have to expect it. So here are some tips that might help at meal times. Simplify meals. Just put down in front of them what they need to eat right now. So if you have soup before you have your lunch or dinner item, just put the soup spoon, and that's it. When there's so much stuff, it's distracting and they're looking at everything. You just want them to focus on their soup with their spoon. When that is done, then you move to the next part of the meal. Right? It does work much better. Set up a regular eating routine. Breakfast, lunch, dinner. Try to keep it as routine as possible. Allow plenty of time to eat. It takes them a long time to get it into their mouth, to chew it and swallow it, process what they're doing. Again, this is another thing you cannot rush. Make sure, you leave an hour to eat. Use finger food, and I think I've said that, is they are eventually not going to be able to use a fork, get it into whatever they are trying to put in their mouth. It's just not going to work. They don't have that dexterity, that eye-hand coordination. So you know what? Start using finger food. Cut it in portions that they can pick it up and eat it. It's not so embarrassing to them, and you think that's funny, but they know that, oh gosh, look at me, I'm a slob. They're never going to be able to say that, but they know, or they will, know by what somebody says, oh, look at what you did. No, that's not good. So use finger food, it's okay. And of course, lead by example and eat alongside the person. It is so important to do that, and whether it's you or a caregiver, another caregiver. Nobody wants to eat alone. Think about it. Eating is socialization. You can talk, or, not that watch TV is the best thing, but if talking is a problem, watch something, listen to music. But it's socialization. It's so important. Grooming. The person with dementia really hates to groom. They have problems grooming, and that's probably the problem. Their hair and, a little makeup. They forget how to do it, why to do it. I think most people, most women like to have others provide grooming, if their hair is longer. In one of our dedicated units for people with Alzheimer's, it was like a routine. Every Wednesday, they would get their hairs done, or the staff would do their hair, curl it, or comb it, and it was a fun thing. It took them all morning, but they did it. Some people forget to, they don't want help, but there are ways you can encourage it. They can look at themselves, see what's happening, little makeup on some of them, all anything to make them happy and, to make them look pretty. When staff comes, they don't want to see, or what, maybe I should rephrase that. They want to see the person they remember with their hair done and makeup. So, it becomes a little more difficult, but you can do it. Dental care, right? If somebody is having difficulty eating, that's one of the important things to look at. Our people can't always tell you that they have a toothache. So you have to observe them, and are they having trouble chewing on one side or another, or they kind of cringe when they're eating something, something very hot or very cold. You really have to watch their faces to see if there's a problem. Same thing with digestion. Some people don't swallow so good as time goes on. You need to watch this as well. The muscles are, not working as well as they used to. So swallowing could become a problem. So if you do note any of that, of course, you see your dentist or your doctor. But some other tips that you can do is give them short instructions. Make sure they're putting a little bite in, a little bit of something in their mouth, not shoving everything on their plate. Let them watch you eat, and then you do it, and they do it, and you do it, and they do it. And in your processes of grooming and dental and mouth care, monitor their mouth care. Do you see redness? Is there a sore? Look at their tongue. It's really important that somebody watch closely what's happening when they eat. The bathroom, using the bathroom. Well, you can expect at some point loss of bladder and bowel control. And there's so many causes that they don't recognize that natural urge. They forget where the bathroom is. They forget how to use a bathroom. Or there could be a simple reason, like it's a side effect from medicine. Could be another medical cause that maybe they were not aware of, and a doctor needs to look into it. So there's lots of reasons that people lose, their bowel and bladder control. Sometimes they just don't recognize a bathroom, or wherever the urge hits, that's where they're going to be. In our dedicated unit, we had for a while these fake trees. Looked really pretty, but some people thought it was the bathroom. So we had to get rid of those. Assist a person to the bathroom. Make sure there's nothing in the way, nothing that's going to make them trip like those rugs. And use reminders. One of the best things, I think, is to have a routine every 2 hours, let's say. Take them to the bathroom. Even if they say I don't have to go, we still take them. And you know what? After a while, they know the routine and are waiting for you to take them. And that might help control that loss of control. Bathe when the person is feeling their best. Time of day, what day. Keep it simple. Don't get too. Don't get too. A lot of times, especially as the stage goes on, they will need assistance, and modesty is an issue, which most of the time is an issue. Minimize frustration and confusion with dressing. All right. Provide simple directions. Now, lay out clothes ahead of time and in the direction they put them on. So your underwear, your shirt, your socks, your pants, then your shoes, in that order, and let them, with your prodding, let them know this is the direction. Now, one of the things we recommend and families recommend, have duplicates of your shirts and your pants, because people tend to not want to change their clothes. They like what they're wearing. You'll put it in the laundry, they'll take it out of the laundry. So by having duplicate of their clothes, you can take the ones that have to be washed, but they still see the ones that they were wearing. And that's a suggestion that has always been given. So let's look at what Hazel has to say about her husband.
In terms of his daily living activities, he is unable to, he chooses his clothes, but they're very inappropriate at times for the season. He will wear a flannel shirt in the summer, and in the winter he might want to go out in khaki pants. He just sometimes reverses the seasons. He needs to be prodded in terms of changing clothes, or I have to get the shirt or the slacks in the evening, because once they're on, they're not going to be changed. So certainly his ability to wash his face, he is lost. I have to write down instructions about how to do that, how to shave. He can still take a shower on his own, he still shaves on his own, he still brushes his teeth, he still can wash his face, but he needs the cues. And so we have index cards that he follows.
Another good way, index cards, stickies, notes, anything that will help them remember the steps of what they have to do. Reverse season she was talking about. We had a person, I have a lot of stories. We had a person who got confused in the middle of winter. She came out in her bathing suit. So she was a little confused. She thought she was going to go swimming, and meanwhile everyone had, long shirts and pants on. So it happens. It is a part of what goes on. Kind of see the humor, and you can't get upset at them because they don't know. So trips to the hospital. Hospitalizations may become necessary for people with dementia, and you can try to reduce stress by preparing them in advance. Think about, who will be there for you. Pack an emergency bag for both of you, and bring the documents that are always asked for, always needed. What's, I think, a great thing that is done in some hospitals, not all, is they have a special emergency room department for people with Alzheimer's and dementia. And what a wonderful place, they recognize all the communication and the behavior problems. That's all that's in this particular area. And these people are trained to deal with that. And, it takes away that anxiety, at least for you, and for them too. And it really is wonderful. Now, working with hospital staff, techniques that, have helped is let the staff know what the person's baseline is, where they're at in the process. Include the person's routine as much as possible. And do not talk to medical staff in front of your loved one. They don't understand, or they'll understand a part of it, and it just leads to more confusion. So, try to have these medical discussions while they're in the hospital, outside of the room.
Support public libraries. Like, share, and subscribe for more great videos.